How can you tell your blood pressure is high? That is a great question. If you've been concerned that your blood pressure might be higher than what it should be, then you may have asked yourself this question. If that sounds familiar, then you are in the right place because I'm here to answer that question in today's video. Let's get started. Hi, I'm Dr. Kelly Shockley, Doctor of Cause, chiropractic, board certified in sports medicine, and specialized in clinical nutrition. In this video, we're going to go over the number one way to determine if your blood pressure is high. There is a method to the madness, so you're not going to want to miss this one. Then we'll cover the most common mistakes you're unknowingly making because life is hectic. If you implement these simple little lifestyle shifts, you will have blood pressure dropping immediately. And finally, I will be sharing with you how to eat your way to normal blood pressure. With every bite you take, you are either improving it or you're stressing it out. Plus, I'll be sharing with you the number one lie you've been told about this seasoning for your whole entire life that you no longer have to believe. Let's get started. What is the number one way to determine if you have high blood pressure? Well, the simple answer is to take your blood pressure. But here's the thing. It is a little bit more complex than just slapping on an armband and hitting a button, right? Anymore now, you can very affordably get a blood pressure cuff at home. Now, I haven't been to a grocery store, like a normal grocery store in a while, but I'm sure near the pharmacy you can still have access to a blood pressure machine to be able to just check in and see how you're doing. Here's the rule of thumb that you need to know though. Oftentimes when you go to the medical doctor's office, they don't necessarily do it this way. Either like nurse rushes you back, quick does some of your vitals, takes your blood pressure, and gets you into your room so that you can then wait for your doc. There is a method. If you really want to get accurate numbers, you need to go into a quiet place. You don't need commotion, which is why the grocery store area is not a great idea. You don't want commotion. You want it to be quiet. And you want to have a chair that has a back to it, okay? Sit down, get yourself set up. It is best to do it on your left arm and on the skin, not through bulky clothing at all. And also, if you have a long sleeve, just pull your sleeve up. Sometimes it puts too much pressure on your arm that it's really ideal to just have a sleeveless or a short sleeve shirt that you can easily, pull up the fabric without there being any restriction on your arm. So go ahead and get yourself set. And then sit back in your chair so that you're relaxed, your back is supported. Wait a couple of minutes, literally wait a couple of minutes so that your blood pressure can normalize to this position. One of the things that annoys me to no end if I go in for an annual exam is they rush me down the hallway and then they take my blood pressure. You didn't wait a couple of minutes, and our blood pressure will be higher when we've been moving around. It will be higher as soon as you change your positions, assuming everything is actually working correctly, because your body has to do that in order for you to accommodate the new position you're in. Or when you're moving around, your heart is working a little bit differently than if you're sitting and you're truly at rest. So sit down, relax, get yourself ready, make sure nothing is too tight, have your back supported. Best for your arm to actually be on a counter that is about, chest height, give or take, okay? And then wait 2 minutes before you hit the button. And while it is taking your blood pressure, just take nice, slow, controlled, deep breaths. Be in a happy place. If you get super nervous about getting your blood pressure taken, even if you're doing it on your own, there is something known as white coat anxiety that you can increase your blood pressure just because you're anxious about having your blood pressure done. Okay? So try to think happy thoughts. Go to, in your brain, picture the most relaxing environment you could be in while your blood pressure is being taken, and that will help give a more accurate read. Okay, here's the other thing about doing your blood pressure. First of all, it needs to be done correctly for it to be accurate. Second of all, high blood pressure can never be diagnosed off of one reading. Okay, if you've gone in and the doc's a little concerned at all, the best thing for you to do is track your blood pressure at home. Take it every single day around the same time of day. Do it properly as I just instructed and notate what that actually is. If you are consistently seeing numbers that are high, then you probably need to go have that further evaluated. Okay. And right now, the classic standard of what is normal is 120 over 80. Nobody really freaks out at 130 over 90. When you start getting above that, then they're going to start talking about different types of approaches for how do we get this down, okay? So in order to really diagnose high blood pressure, it's taken on an average reading, not just one reading or even 2 readings, but take your reading several days in a row and then it's the average of it. It is important to take it at the same time. And also, little tricks for you to know is if you've had any kind of stimulant like caffeine, your blood pressure will be higher than what it would be otherwise. If you're taking a medication that is a stimulant, like Ritalin, it will be higher than what it would be otherwise. And you'll also see that your heart rate is elevated compared to what it would be. So there is a method to the madness. Now, if you go to the American Heart Association's website, they will tell you that there's really no symptoms associated with blood pressure. Generally, that's fairly true, but there are some other symptoms that you might be experiencing that could tip you off to maybe there is an issue with my blood pressure. So I wanted to share those with you as well. Most commonly, people who have elevated blood pressure might have some of the following, whether it's headaches to maybe frequent nosebleeds, shortness of breath, feeling fatigued, you're not being able to recover the way that you used to. Chest pain obviously is concerning, an irregular or a fast heart rate, pounding in the chest or the ears or the neck, like you can just literally hear your heartbeat with every beat that it's taking. Occasionally you'll get blood spots in the eyes. Also, dizziness could be something that results from an issue with blood pressure in general, whether it's low or it's higher, it's not changing the way that it should. And then the one that I see more commonly, especially if blood pressure is very elevated, is flushing in the face. So if you're dealing with any of those symptoms, then you definitely want to be checking your blood pressure and just see how is it coming in. But make sure you're taking your blood pressure correctly. Now, I'm really curious, did you know that blood pressure being elevated is something that often doesn't give you any kind of sign or symptom? Comment down below what your thoughts are on that. I mean, obviously, I gave you potential symptoms, but as the American Heart Association says, most of the time, high blood pressure doesn't give you any sign or symptom. Did you know that? Comment down below. I read every comment. I reply to every comment. I appreciate the engagement. Now we're going to get into the common mistakes you're unknowingly making because life is hectic. And what can we do to try to start changing that? Well, the very first thing we need to do is we need to get moving. We were not meant to be static. Okay? We were not meant to sit in front of a desk for 8, 10, 12 hours a day without really moving around, which is part of why you saw a few years back that it came online that sitting is actually worse for you than smoking is. It contributes and leads to more health problems than if you were actually smoking. That's really concerning. Okay, so don't get locked in to trying to get all your work done, and before you know it, 4 hours has gone by, you haven't had water, you haven't used the restroom, you haven't even moved, you've just been working. We're not supposed to be machines. Nope, we're living beings and we need to move. Being dynamic is what helps the circulatory system actually be healthy. So we need to move more. Get moving, whatever that means, whether it's a walk, down to the park, or you're getting up and down out of your chair, you enjoy dancing, you actually go to the gym, like whatever movement is enjoyable to you, do that and do it every single day. One that's probably a little bit obvious, but isn't always the easiest to accomplish is trying to shed those unwanted pounds that who knows why they're ending up there. Maybe it's because of poor diet and not enough exercise. Maybe it's because of hormones being off kilter and, life is stressful and you're not sleeping the way that you should be. So everything's kind of a muck and you're holding on to excess pounds. Oftentimes those excess pounds are most frequently inflammation. So trying to figure out how to shed those unwanted pounds is something that will dramatically take stress and pressure off of your cardiovascular system and is a phenomenal way for actually lowering your blood pressure. Now, if you, whether it's in the form of smoking or chewing or vaping, you have an addiction to nicotine, it's one that you should seriously consider stopping. It puts a lot more stress on the circulatory system and the heart in general, and very oftentimes can lead to elevated blood pressure. A strategy that has worked really well for majority of people is actually getting acupuncture done and hypnosis for, believe it or not, for stopping smoking or vaping or any kind of nicotine addiction. So I would strongly encourage you to explore that, because it's by far one of the most common causes of high blood pressure in people. It's oftentimes that you won't find somebody who has a nicotine addiction that has normal levels of blood pressure. So very much so, explore the options and really try to nick that habit. Another one that kind of goes against social, standards these days is alcohol. Alcohol very much so is stressful on the circulatory system and heart, and can lead to not only high blood pressure, but also rapid heartbeat or heart palpitations. Oftentimes people are consuming too much alcohol in a week or in a sitting. And even though like red wine has some benefits with resveratrol and that around heart health, it's honestly not worth drinking if you're drinking it purely for heart health, or at least you're saying you're drinking it for heart health. It creates inflammation in the system, which think of that as like swelling from inside. And that makes it a lot more difficult for your heart to do its job and to circulate your blood through your body. Also, it is dehydrating in its effect. So if your blood is not well hydrated, think of it as more like your heart's trying to pump sludge through your arteries and your veins. It's not going to work really well, and the heart's going to have to work that much harder, which is going to increase blood pressure. So if you are somebody who really enjoys having an adult beverage, fine, but make sure you're not going over maybe a drink, each day that you're going to choose to consume. Or look for a different alternative, honestly. Like I said, there's not really any benefit that comes from it when you consider the potential risk that it's putting you at. Another one, like if we could live in a perfect world, we'd get rid of stress, and oh my gosh, you would see so many people's blood pressure levels actually return back to normal, because stress very much so influences blood pressure. There's like a direct correlation there. So while we don't live in this ideal stress-free life, and unfortunately, I don't believe we're going to be completely immune to stress, it just happens, there is a way that we can work on managing stress and implementing stress-relieving tactics on a regular basis that help the body decompress, help the body actually calm down. And that can be anything from meditation to yoga to going for a walk in the park, reading a good book, having a nice Epsom salt soak in the tub, even deep breathing. Just a couple of moments of focusing on deep breathing really can bring blood pressure down. It can bring your heart rate down. People that feel anxious or nervous can start feeling calm pretty much immediately. It's very effective. So maybe partway through your workday, you have a bit of time set. There's an alarm on your phone that has you do some deep breathing for just a couple of minutes. Like, honestly, that's not going to derail your day. And then you do that again before you go to bed. Maybe you start your day that way so that you have this happening a few times each, throughout the day. Very effective for helping you manage those stress levels. Now, before I get into how to eat your way back to normal blood pressure, I just want to take a moment and remind you to click that subscribe button down below, turn the notifications on, and if you're enjoying this video and you're getting great information out of it, just give me a big thumbs up. I greatly appreciate your support. I am regularly producing videos for you about heart health, brain health, gut health, you name it, anything to help you be able to take back control of your health so you can live the highest quality of life possible while you're here. So I don't want you to miss out on future episodes. So just make sure you click the subscribe button, turn the notifications on, and give me a big thumbs up if I'm doing a good job for you. I appreciate your support. Awesome. How do you eat your way to normal blood pressure? Well, this involves us talking about a few things that we found out that are not great for us to be consuming because it puts more stress on the body. If you've looked at this at all, you've probably run across something known as the DASH diet. This is one of the diets that came online a long time ago for helping people be able to lower their blood pressure. And it is effective. However, there are some changes in there based off of what I've seen research-wise that I want to share with you. I'm not really going to share the changes per se, but I'm going to give you a different way to eat than what's outlined by the DASH diet. By all means, you can follow that. It will more than likely work. But what we've seen come about in the decades, they changed our food pyramid back in the 70s. So we have research that goes back at least to the early 70s that shows support for what I'm going to share with you right now. This is the most effective way to eat if you want to lose weight, if you want to have a good body composition. So like fat percentage compared to lean muscle mass, blood pressure, cholesterol levels, diabetic factors, inflammatory markers, you name it. We as a human species seem to respond best overall, not just one category, but overall to this way of eating. So the first and foremost thing that we need to do is we need to eat whole, real foods, right? Unfortunately, we live in a hectic lifestyle, and it oftentimes steers us in a direction for reaching for something that's convenient. And it's a problem because those convenience foods are the ones that are loaded with the sodium that's been associated with increasing blood pressure, all these other additives and different chemicals that stress the body and cause inflammation, which points in the direction of high blood pressure. It also is a place where you're going to find a lot of sugars, okay? If I told you the one food category to cut out altogether, it would be sugar. This is part why alcohol is not awesome for you, is because it converts or it spikes blood sugar very easily. Sugars, as we know it, do this. All of our pastries, our baked goods, and even our grains are really good at spiking blood sugar levels. Now, there's a lot of controversy around grains. Are whole grains good for us or not? Well, the whole grain version compared to the refined version at least does have more nutrients. However, when you start looking at a food's ability to cause inflammation, which inflammation is the root cause of all disease and illness, grains don't really measure up all that well. Okay, so working to modify how much grain you're consuming would be really smart. We are not supposed to eat grains at every single meal. And research that dated back to the 70s, basically what they found out is we need to eat small amounts of carbohydrates, and those carbohydrates really need to come from vegetable sources. And fruit, minimally. Like, you don't need to eat fruit every single day to be healthy. It's the one that people really want to reach for most often because, again, it's sweet, and we are a sucker for sweet. Believe me, it's an addiction. They've shown that sugar is the most addictive substance known to man. We treat it as if it's like cocaine, the way that our brain responds to it. So ultimately, not having a lot of natural occurring sugars as well is actually better for us too, partly because inflammatory, not just because of the addiction side. So carbohydrates should be coming from vegetables, not necessarily grains, and definitely not the amount we've been consuming. Okay, so like 20% or less of what you're consuming in a day should come in the form of a carbohydrate, and we want those in vegetable form. If you look at the DASH diet, they want you to stay away from a lot of animal proteins. Now, there are a lot of different health issues that have been associated with animal proteins, but the problem is it's not the animal. It's what we've done to the animal that changes the story. Okay? Cows are not meant to eat grains, yet that's how they're conventionally raised in America, in feedlots where they can't move around, they stand in their own excrement. Like, it's disgusting. That's not how God intended them to live. If you compare a grass-fed or a grain-fed cow to a grass-fed cow, you've got an entirely different picture, an entire different makeup of their tissues. Grain-fed cows create lots of inflammation. They're generally injected with antibiotics and hormones. So yeah, you don't want to eat that because you're absorbing everything that was put into their bodies. Bad idea. That does cause problems. Grass-fed, grass-finished cows, not injected with anything, raised the way God intended them to be. They're very anti-inflammatory. In fact, they have the same omega fatty acid ratios as what wild-caught salmon does. It's actually really good for you. So that's where one of my big issues is around the DASH diet, is they don't want you eating animal proteins. If you can make sure your proteins are coming from clean animal sources, raised the way that God intended them to be, you're not going to have health effects from those animal proteins. Okay? So proteins, I say, eat around 30% of your makeup. And I prefer you eat the animal proteins, not this artificial made in a lab type of protein. I avoid soy. There's a lot of controversy around soy. There was studies that have come out that shows it's actually stressful to the heart and that it's a great precursor for estrogen, which nobody needs more estrogen in this world right now. We're already being exposed to a lot of it anyway. Okay. So clean proteins coming from animals, nuts, and seeds, all the way that God intended them to be. And then fats, also DASH diet has you stay away from fat. Bad fats are bad. Okay, but we don't want to stay away from fat. Fat does not actually clog up your arteries the way they used to think it does. In fact, healthy fats are very anti-inflammatory. They're healing to the gut. They're healing to the cardiovascular system. They're needed for proper brain function. They're in every single cell of the body. So we have to have them. But we need the good sources of fat, and we want 50 to 70% of what we're consuming to be of these healthy fats. Okay? Vegetables are a great way to get these in. If you're looking for how do I get more coconut oil, grass-fed butter, avocado oil, extra virgin olive oil into my life, that would be your trick. Okay? So you can eat your way to lower blood pressure. You just have to know what you're doing and trust that this is information that's been around for decades and decades and decades. It's not just a fad. Unfortunately, there is still not enough knowingness around it, and with how our food supply here is in America, they're not really helping us be successful. I feel like they're actually setting us up for failure. Okay? Now, we got to talk about the number one, lie you've been told about a particular seasoning to avoid because it causes high blood pressure. It is the dreaded salt. Okay? Now, here's the thing. There is truth in what's being said. Salt, like table salt, is sodium chloride. Sodium chloride on its own in high amounts, which is what they use in all of your prepackaged, canned, prepared foods, is sodium chloride. Too much of that is going to increase your blood pressure. For sure. It will cause a problem. However, that is salt in its refined version. Okay? Whole version of salt actually contains a bunch of other minerals and nutrients that your body really does need to have. My favorite go-to, whole unrefined salt is Celtic salt. Now, Himalayan works as well if you're truly getting Himalayan salt, not just pink salt, salt that's been dyed pink, but actual salt in its raw form, not refined. It works, but the difference and the reason why I like Celtic better than just Himalayan salt is because Celtic salt is still harvested with wood utensils. Now, Himalayan can be harvested with bulldozers. I do a lot of work with heavy metals, and just decreasing potential exposures is why I opt for the Celtic salt. So here's the thing. There are doctors that put their patients on Celtic salts who actually help lower their blood pressure. You need all those minerals. We're not getting enough of them. You can have salt, but it needs to be Celtic sea salt or Himalayan. You can find that at any of the natural health food stores or your grocery stores that have incorporated more natural health options in them. Or you can find it online too, really easily. So you can have your salt. In fact, you should eat some of the salt because you're going to get more nutrients in and it won't affect your blood pressure whatsoever. Now, if you're sitting there wondering, okay, Kelly, I kind of have an idea how I'm supposed to be eating, but not entirely. I'm not quite sure what that looks like. I hear you talking DASH diet, but I really don't want to look it up, which is fine. I don't want you to eat that way anyway. Don't worry, I've got you. Click below this video on the description, okay? Make sure it expands, and then scroll down and look for the 7-day full body reset meal plan. This is a meal plan that I created just for you. It's geared towards people who don't want to spend all of their time in the kitchen, or maybe who don't even like cooking at all, but know you need to in order to be healthy. I've included your grocery list and all of your recipes that are delicious. They are all geared towards helping take stress off the heart, reducing inflammation, improving your overall health and well-being, so that with every single bite, you can be working your way back towards normal blood pressure and not have to add in medication or get yourself healthy enough that maybe that's an option for you to come back off of and just start living a healthier life. So again, click the description down below this video, find the link for the full body reset meal plan, and just click on that and it'll be yours. Awesome. I appreciate you being here. I hope today was awesome for you as well, and I can't wait to see you on a future episode. God bless.